the signs and symptoms to look out for of infection in the postnatal period, whether you've had a vaginal birth or a caesarean birth. This is worth a watch and a save. And I'm Angie. If I haven't met you yet, I've been a midwife for just over 13 years now, and I'm a registered health visitor. And you can hit the follow button for more pregnancy, birth and parenting information. And if you had an infection postnatally, what were your symptoms that you had? The chance of developing an infection after a caesarean birth is around 1 in 10 women. It's 10% chance. In contrast, a vaginal birth with no tears is around about 1 to 2%. However, having tears, having any symptoms of sepsis or infection during labour and birth can increase that chance slightly, but it's still lower than a caesarean birth. So as a starting point, before you are discharged home, you should be provided with all the numbers that are 24/7 numbers to be able to call for urgent advice and information in that postnatal period, and to be able to get individualised advice. If you have any of these symptoms, I want you to call them straight away. Your maternity providers are open 24/7, 365 days a year, even on Christmas. So the first symptom is fever. If you've got a fever higher than 38 degrees C, you need to be calling your providers. If you're feeling hot, cold, shivery, nausea, vomiting, unwell in yourself, like you're coming down with flu and cold and just infection in general. If you are noticing any smells that don't smell particularly right, either from the stitches or from your wounds, again, that can be a sign of infection. Sudden abdominal pain that's different to before. So after pains are really common, but they should ease after a day or two, and they should get easier. If they start increasing intensity in pain, if you have decreased the amount of pain relief you've needed, but suddenly you need more of it, that pain abdominally or around your stitches or your scar, and suddenly needing more pain relief can be a sign of infection. Redness, tenderness, sometimes like a lump, a hard lump can be also a sign of infection, particularly around any scars. If you feel like your heart rate is absolutely racing, pounding in your chest, and you're just not feeling right, give your maternity unit a phone call for that individualised assessment. During that assessment, they will take all of your observations, they'll check you over, check any scars that you might have, feel your tummy, and then ask for a doctor to come and review you. That doctor will then decide whether or not you need to be an inpatient in a hospital and be readmitted for IV antibiotics. So that's antibiotics that go into your veins, work really quickly. This is particularly if you've got quite a severe infection, and sepsis, for example, is a possible complication. If not, they might send you home with some oral antibiotics. It depends on lots of factors, what your observations are, where that infection might be, if it's been caught really early, and whether it can be treated at home with follow-up advice. If you needed to come back, you could come back in, or whether it's quite severe and they're really quite concerned and they want to readmit you. Most maternity wards will readmit you with your baby if you're happy to have your baby with you, and that means that you can continue the care and continue feeding your baby too. Some mums with good support networks sometimes send their babies home so that they can have as much rest and as much recovery as they can in a hospital if they are readmitted. You should all know the signs and symptoms of infection. You should know where to call, who to call, and have that assessment if you need to. And remember, they are open 365 days a year, 24/7.